planning level presentation by Amanda Brown. The population is adults aged 18 to 25 with mental health and substance use disorders in North Carolina. Mental health and substance use disorders are among the top conditions for disability and burden of disease in the United States. There are different types of treatments for mental health and substance use disorders, but not everybody has access to those due to inadequate health care. North Carolina access to services and supports for individuals with mental health and substance use disorders varies based on several factors. Some of these factors include insurance coverage, specific type of mental health or substance use disorder, and geographic location. According to Yan Duong with the NC Health News, North Carolina scored a F on their report card for how well the laws support the federal laws that were passed a decade ago calling for mental health to be treated on par with physical health. Facts based on the 2019 and 2020 National Survey of Drug Use and Health. 29.2% of adults aged 18 to 25 had any type of mental illness in the past year. 93,955 people aged 18 to 25 had a serious mental illness in the past year. 10.6% of adults aged 18 to 25 had serious thoughts about suicide in the past year. 43,768 people aged 18 to 25 made suicide plans in the past year. 266,398 people aged 18 to 25 had a substance use disorder in the past year. Now imagine all those numbers. 38% of Americans reported having to wait longer than 1 week to receive mental health treatment. On top of the stigmas around mental illness and substance use, there does not need to be anything else standing in the way of the individual to receive the appropriate help they need. The more obstacles that an individual has to face to receive the proper treatment gives them more of a chance to give up and end up either self-medicating or turning to suicide. There are current policies, acts, and laws in place to help treat mental illness and substance abuse disorders, but it's still such a large problem. The Health Parity and Addiction Equity Act was passed in 2008 to ensure mental health care patients receive the same benefits as patients who have physical health issues. The Consolidated Appropriations Act is a new obligation for group health plan sponsors and insurers that provide health insurance to document that their group health plan or insurance policy complies with the non-quantitative treatment limitations of the Mental Health Parity and Addiction Equity Act of 2008. The Affordable Care Act provided more Americans with access to insurance and behavioral health treatment, but the cost of private insurance has risen, and some people with mental health conditions are still denied treatment. The United States has worked towards making mental illness and substance use disorder treatment more affordable through those previous policies mentioned, but that's still not enough. In other countries, in Switzerland, health insurance providers are required to offer comprehensive policies that cover a range of conditions. They must include mental health and substance abuse care. Their treatment costs associated with mental health condition and alcohol abuse are lower. The government also regulates the cost of service, and yearly they only have to pay a maximum $700 for outpatient mental health services. Canada, Germany, Netherlands, and United Kingdom have removed out-of-pocket costs towards primary care visits, and France has waived all co-payments for care related to long-term chronic mental illness. The RAND Health Insurance Experiment found that participants with free care used approximately 4 times as many mental health services compared to those in the highest cost-sharing group. Health insurers fear that generous insurance benefits may induce patients to overuse mental health services of questionable benefit. Also, lower mental health co-payments may attract enrollees with a high propensity for using mental health services, a phenomenon known as adverse selection. I would have to work with the NC Senate, Tom Tillis, and Ted Budd in passing the Medicare for All Act in North Carolina. The 2002 bill for Medicare for All includes some major improvements from the 2019 version. Global budgeting on hospitals and other institutional providers. The global budgets would fund hospitals with an annual lump sum payment which can be used for patient care. They would also prevent hospitals from closing in rural and other underserved communities with stable funding. The global budget also promotes health equity by funding services and capital projects based on community health needs and not what is most profitable for hospitals. The standardized fee for service payments to providers, expanded benefits, and Office of Health Equity. While Medicare for All will be very beneficial, there are still some cons that I will need to look further into. For Medicare for All, the benefits, they cover all medically necessary services, provides full choice of any participating doctor or hospital. Providers may not dual practice within an outside Medicare system. The patient cost provides first dollar coverage without premiums, deductibles, or copays for medical services and prohibits balance billing. you do have to pay a small copay for some brand name prescriptions. The eligibility covers everyone in the United States regardless of immigration status, prohibits duplicative coverage, negotiates drug prices with manufacturers, and funds hospitals through global operating budgets. Provides a 4-year incremental transition to Medicare for all. The target for change and problem is the inadequate health care in North Carolina, resulting in mental health illness and substance use disorders to not be able to receive treatment they need. Positive change would be that everybody in North Carolina and throughout the United States would be able to have access to the health care that they need, little to no cost. Senator Bernie Sanders, along with 14 of his colleagues in the Senate, sponsor the Medicare for All Act currently. The North Carolina Senate and the United States Senate will need to be involved to make this change happen. To find out if your senators are to be able to reach out to them regarding the Medicare for All Act, you can find their contact information on senate.gov website. There are many different articles online you can view to learn more about the Medicare for All Act and see what is exactly included. You may reach out to your state senators if you have questions regarding your state's affiliation and whether your state senator has become a co-sponsor. You can also look at the congress.gov website. The number one theory that I believe will help in guiding this intervention will be community organization theory. Since this organization focuses on healthcare of citizens, it aligns with community organization model. This intervention has each citizen's best interest in mind when it comes to healthcare and accessibility. The specific goals are for every North Carolina citizen to have access to mental health and substance use treatments and care when they need it, with nothing interfering them to do so. The goal will be measured over the years by looking at how many people with mental health problems and substance use disorders were able to get the help they need versus how many were still unable to get the help they need and why they were unable to get the help. The hardest part of the Medicare for All Act is to have the act passed and put into play. Once this is done, it will be easily sustainable. Once there will be some factors that will need to be changed over time after reviewing data, such as needing more doctors or figuring out how we can do less wait time since there will be more people utilizing the care that is accessible to them now. While this act is going to be very beneficial overall, there are still going to be some obstacles faced at first. Since everybody will have access to the care that they need, there's going to be longer wait times for patients. This is going to be because there's going to be so many more patients than there will be doctors and nurses. The overworking of doctors and nurses can lead to doctors rushing through their appointments with patients and not giving the best care that they can give because they're trying to move on to the next patient. Even with the potential obstacles that may be faced after the Medicare for All Act is put into place, there are so many more benefits that outweigh the obstacles. Healthcare is a right, not a privilege, and should be accessible to all citizens of the United States no matter their employment status, socioeconomic status, race, ethnicity, etc. Everybody should have equal access to healthcare they need when they need it. This will result in a healthier, happier America.